Fine.
Okay, so my name is Manu Singhal and I am second year medical student. So today I am going to examine your abdomen for any abnormalities. So what's your name?
My name is Kashish Mahawar and I am 19-year-old.
Okay, that's good. So do you have any issues? Do you have any pain over your stomach, over your
No.
this area?
No.
This area called the abdomen. Okay. So let's start the examination. Before examining the abdomen, make sure that patient has emptied his bladder. After that, ask the patient to lie down and relax. Expose the supine position of the patient abdomen by raising his clothes to below the nipple line and lowering the drop to the suprapubic level. Now, inspect the skin for the scars, tear, dilated veins, rashes, or ecchymosis. Also, inspect the symmetry and contour of the abdomen. Is it the flat, rounded, protuberant, or markedly concave, or hollowed? Are they bulges? Also observe the umbilical to look the sign of inflammation or hernias. Now listen for the bowel sound by placing the diaphragm of the stethoscope gently over the quadrant each. Listen to the abdomen before performing percussion because these maneuvers may alter the frequency of bowel sound. Occasionally, we may hear the normal stomach growling of the patient as a high blood pressure or a arteriosclerosis diseases. Listen in the epigastrium over the aorta, then listen over the artery and the femoral arteries. Then then light percusses the abdomen to assess the distribution of tympani and dullness of tympani. By palpating, identify any tenderness or increased resistance to your hand and observe the patient face for identification of any tenderness or discomfort. And also ask the patient to take the slow deep breath. Watch for an acute abdomen for inflammation and partial peritoneum or peritonitis. Sign of acute abdomen from inflammation of parietal peritoneum or peritiosis include abdominal pain with cuffing rigid or broad like abdomen, guarding, rebound, and percussion tenderness. For the liver examination, percuss the liver span. After locating mid-clavicular line, use a light percussion to moderate strike. Palpation over the mid-clavicular line is important for the examination of the liver. After palpation, we do a percussion. In percussion, there is two types of sound. Dullness sound shows the positive sign, while clear or musical sound shows it's normal. So let's start the percussion. Starting at the level below the umbilicus in the right lower quadrant in an area of tympani, percuss up toward the liver. Identify the lower border of dullness in mid-clavicular line and then identify the upper border of liver dullness and then we measure the span of liver dullness. Normally, the span of liver dullness is around 7 centimeter. In this, we do a percussion from lower side then to upper side and measure it with a scale. We get the 2 points, the lower point and the upper point, and then after measuring we get the readings of 7 centimeter, which is basically a normal span of liver. Now for the spleen examination, we do a same examination procedure. First the palpation, then for percussion. When a spleen enlarge, it expands anteriorly downward and medially, often replacing the tympani of stomach and colon with the dullness of a solid organ. It then becomes palpable below the costal margin to palpate the spleen to access its size and reach over. With the patient, take the deep breath, feel the spleen as it comes down. The tip of spleen is palpable in only 5% of normal adult. When the spleen size is normal, the percussion note usually remains tympanic. But when the spleen is enlarged, tympanic often changes to dullness. Dullness is a positive sign. It may be falsely positive, and its presence means we need to perform careful palpation. For all findings that we observed during the examination, we need to record the findings. It's a clear and impressive. Record the finding. The abdomen is protuberant with active bowel sound. It is soft, non-tender, no mass and hepatosplenomegaly. The liver span is 7 centimeter in the right MCL. The edge is smooth and palpable. Thank you.